In the early 1980s, a mysterious and frightening new illness began to appear in hospitals and communities across the world. Doctors and nurses were baffled, as patients, many of them young and previously healthy, suddenly fell gravely ill with rare infections and unusual cancers. The medical community was on high alert, but answers were few and far between. This disease attacked the immune system, stripping away the body's natural defenses and leaving people vulnerable to infections and cancers that would normally be harmless. Hospitals filled with patients whose conditions rapidly worsened, and doctors struggled to provide care as the illness spread. Eventually, scientists identified the illness as AIDS, acquired immune deficiency syndrome. The cause was traced to a previously unknown virus, HIV, the human immunodeficiency virus. This discovery was a turning point, but it also brought new fears and challenges. Fear and uncertainty gripped the world. For many, an AIDS diagnosis felt like a death sentence, as there were no effective treatments and little hope for recovery. The media was filled with stories of loss and tragedy. People were terrified of catching the virus, and those diagnosed often faced harsh stigma and discrimination. Many lost their jobs, their homes, and even the support of friends and family. The future seemed bleak, and fear spread faster than the disease itself. However, even in the darkest hour, hope flickered. Communities came together to support those affected, and activists demanded action, compassion, and research. Doctors and scientists around the world joined forces determined to understand this new enemy and find a way to fight back. Their dedication would eventually change the course of the epidemic, but in those early days, the struggle had only just begun. The fight against HIV has been a long and challenging journey. Scientists work tirelessly to unravel the mysteries of the virus, to understand how it attacks the body and how to stop it. Early treatments were limited and often came with severe side effects. But with each passing year, breakthroughs emerged. New medications were developed, each one more effective than the last. The development of antiretroviral therapy, or ART, marked a turning point in the fight against HIV. ART wasn't a cure, but it was a lifeline, a chance for people with HIV to live longer, healthier lives.
ART, or antiretroviral therapy, is a powerful combination of medications that work together to stop HIV from replicating in the body. These medicines target the virus at different stages of its life cycle, making it much harder for HIV to multiply and spread. Over the years, ART has evolved, becoming more effective, easier to take, and with fewer side effects, making it accessible to more people than ever before. Think of it like a team of defenders, each with a specific role to play in keeping the virus in check. Just as a sports team relies on every player to win, ART relies on different drugs working together to block HIV from different angles, making it nearly impossible for the virus to escape.
By taking ART exactly as prescribed, people living with HIV can suppress the virus to extremely low levels in their blood, sometimes so low that it can't even be detected by standard tests. This is called undetectable, and it's a major milestone in HIV care. This means the virus is effectively stopped from damaging their immune system, allowing the body to stay strong and fight off other infections and diseases. With a healthy immune system, people with HIV can live much longer, healthier lives. The impact of ART has been nothing short of remarkable. It has transformed HIV from a fatal diagnosis into a manageable chronic condition, giving hope to millions of people around the world. People who were once told they had just a few years to live are now able to look forward to long, healthy lives. They can enjoy time with their families, build relationships, and plan for the future. Thanks to ART, people living with HIV can return to work, have families, pursue their dreams, and contribute to their communities, proving that with the right treatment, life after an HIV diagnosis can be full of hope and possibility.
It has helped to reduce stigma and discrimination, and empowered people living with HIV to live openly and without fear. This understanding has, really revolutionized the way we think about HIV. When someone living with HIV takes antiretroviral therapy as prescribed, and their viral load is undetectable, it means the virus is suppressed to such low levels that it cannot be transmitted to others, even through sexual contact. One of the most significant breakthroughs in recent years is the understanding that undetectable equals untransmittable, or U equals U.
The fight against HIV is far from over. Despite decades of progress, the virus continues to impact millions of lives around the world, reminding us that our work is not yet done.
While antiretroviral therapy has transformed millions of lives and allowed people with HIV to live longer, healthier lives, it is important to remember that it is not a cure. These medications must be taken every day, and missing doses can have serious consequences.
People with HIV still face challenges, including the need for lifelong treatment, and the potential for side effects. Managing these side effects and maintaining a strict medication schedule can be difficult, especially for those with limited access to healthcare or support.
But the future is full of hope. Advances in medicine and technology are opening new doors, and every day, researchers are getting closer to breakthroughs that could change everything.
Scientists are working on new treatments, including long-acting injectables and implants that could make taking medication even easier. These innovations could reduce the burden of daily pills and help people stay on track with their treatment.
Gene therapy and other cutting-edge approaches are also showing promise. Researchers are exploring ways to target the virus at its source, and some experimental treatments aim to eliminate HIV from the body entirely.
We must continue to support research, fight stigma, and ensure that everyone, everywhere has access to the care and treatment they need. Only by working together can we overcome the barriers that still exist.
Together, we can end the HIV epidemic. With continued dedication, compassion, and innovation, a future without HIV is within our reach.